Okay, let's get started. Welcome to Leaders in the Arena, a live podcast series by Bridge Innovate. Today's session is my story as an empathetic leader with our special guest, Colonel Carlene Blanding. A bit more about her in just a moment. Welcome to Leaders in the Arena. It's hosted by Bridge Innovate. We are a global network of business strategists, consultants, and designers that team with you to spark distinctive strategy, courageous leadership, and we'll hear about that more today, and agile change to transform your organization for growth and good. This podcast series is designed to share valuable insights and lessons from our clients in our network to support your growth journey. Today, it's a great pleasure of mine to introduce to you Carlene Blanding. She's Vice President of Human Resources for Integrated Supply Chain at Shaw Industries. Carlene Blanding is also known as Colonel Carlene Blanding. She's a human resources executive and joined Shaw in June of 2022 after a stellar career with the Army as a healthcare and human resources executive. Her role in the Army culminated with her service as commander of the Eisenhower Army Medical Center during the most critical healthcare crisis in recent history, what we know as COVID-19 or the coronavirus pandemic. So welcome, Carlene.
Thank you. Thank you for having me.
Yes, it's great to have you here today. Tell everyone a little bit more about yourself.
Okay, so again, thank you for having me. I spent 30 years in the United States Army Medical Department, where, as you've alluded to, my background is healthcare and human resources. I've had just a tremendous career, of course, culminating as the commander at Eisenhower Army Medical Center. And it was during that time that I really got to understand what it is to be an empathetic leader, to lead through empathy. And so fantastic career, great opportunity, experiences that really has carried me through to my joining Shaw. And so it's been a great experience.
Great. Well, we're thankful for you today. I mean, this you're here with us at our Chattanooga office, but home for you is in Georgia, South Georgia?
It is. I live in Evans, Georgia.
Right.
And of course, I travel to Dalton, Georgia, where Shaw is headquartered. So
right.
yes.
And I know you touch the world globally in the work that you do. So we're thankful to have you with us here in person today. Carlene is also a member of our Executive in Residence program, where we invite senior executives to join us to share their experiences and capabilities to mentor our other leaders who are up and coming. We've also been thankful for our partnership with Shaw for over a decade and working on business innovation and leadership work. So today, let's jump in and hear more about Carlene's story. Take us back 3 years ago to COVID-19 and how that impacted the daily life for you as commander of the Eisenhower Army Medical Center.
Thank you. So yes, 3 years ago, it was July of 2019, I came in as the commander of Eisenhower. And so I had 6 months. I came in with, like all commanders, you come in with just, you knew exactly what you were going to do. You had your plan laid out for the next couple of years. You come in, you kind of guide the team. And so for the first 6 months, things were moving along. Then we started hearing of a pandemic. We were actually at a huge conference, and we heard about, coronavirus at the time. And so didn't really think much of it. We're healthcare, so we kept our eye on it, but we weren't really that decisively engaged. And then March 2020 hit, and we were full blown into, planning, addressing, engaging into what, of course, lasted for 3 years when we thought it would be maybe a few months. That completely changed the trajectory of how I was going to lead. It changed my whole plan, right? In how I was going to focus on certain things in a healthcare environment. In a hospital, the day-to-day thing is, of course, safety. It's about making sure that your people are engaged and deliberate in providing the best quality healthcare. And so that did not change, as in the safety and quality healthcare. What changed is how we're going to lead in an environment where it was no longer normal. We did not understand at the time what this meant. We had no idea about COVID-19, the coronavirus. We had no idea how we were truly going to engage. So we were literally building the plane in flight, right? And so I had to step back and figure out how, because now we're thinking about people coming into the hospitals, right? There's a level of fear, right? It was just incredibly
for the staff
difficult.
and for the
Staff and
patients, right?
absolutely,
Yeah,
absolutely.
fear all around.
All around, right?
Right.
Schools, right?
Right.
We have our staff. I mean, we have children. I have two boys. And at the time, I had an elementary and a middle schooler. And here is this huge issue. We're running a hospital. And not only are we running a hospital at Fort Gordon, we also have clinics in Puerto Rico, and we have clinic in Miami. And so how do you engage now in trying to get the message out? It now boils down to, what is coronavirus? How are we going to engage? What is our higher headquarters doing? How are they going to guide us through this? How am I being on ground with my executive team? How are we going to lead? And so talk about disruptive, right? Talk about a moment in time when literally everything stood still for us. I had no idea, right? There was no playbook. We had no book we could go through and say, oh yes, let's do this at this point. That was not the environment. We were literally building as we went.
How did you make time for that? You talked about the importance of empathy at the opening, right? So how do you, in this environment where things are changing in the moment, you have this extraordinary environment of fear, how do you maintain that communication so that you're monitoring how your staff is responding, how they're, and the patients, but that takes time and energy. And at the moment, you don't have time and energy. How did you make that work?
Great question. And so, like everything else, we had to do it. We didn't have the luxury of sitting and waiting, right? Our higher headquarters, they too were scrambling, trying to get information to us. But when you're on the ground, so what we did was 7 days a week, we hit the ground running. We started off, I had some great officers, great colonels, right, who were part of the executive team. We came up with a communication strategy. We started doing virtual discussions, right? We set up ways to communicate to the command. Town halls, that became a huge thing. But remember, we couldn't get together. So I'm giving a town hall from my desk, right? And I'm projecting to the command. And not only in Augusta, but we're talking Puerto Rican, we're talking Miami. And we're day to day, we're getting information every day we're doing this because the fear was unbelievable. And fear of employees coming into work. Now we're a healthcare facility, right? We're a hospital. People are trusting us to have the answers and trusting us to be there when it's time for them to get their care. And so that was the message, right? And I told the team, this is what we have to do. We cannot operate in fear. I have children. I understood that if I could take this virus home to my children. And so the schools had shut down. So now you have to take not just how do you provide healthcare in a very, very difficult environment, but how do you manage families, right? Because our employees have families. I have family. And so we started with the communication strategy. Then we talked really about walking around. We got masked up like everyone else, and we just walked around to check.
Got into the environment.
And at that point in time, the most important people in the entire organization were our custodial staff, because we knew that infection, we could not afford infection in the hospital. And we knew it was a virus. So it was all about the sanitation of our environment. It was all about making sure everything was clean. And so we're walking around, we're leading by example. We're walking around, talking to people and getting, how do you feel today? What is going on? What is happening in your respective areas? What do you need from us? And then we really had just some creative teams that came up with, we knew that folks were concerned about coming into the hospital. So hey, let's move the pharmacy because people still needed their medication. So we did a drive-through pharmacy where we used the staff that we had, we kind of
just-in-time innovation happening on the ground.
Right on the ground. And, it was amazing to see the staff that was there at the time, how they leaned into this very difficult environment. We had nursing shortages has always been an issue, and creativity, innovation. We decided we needed to bring our team in. We started training our teams to work in different areas, which honestly, that was new, right? It was hard for us. Using outpatient nurses to do inpatient care it's not a very comfortable situation. There's fear that, my skills are not where it needs to be. But I will tell you, we had people who came up with incredibly fast training sessions to get the nurses up to speed, and we just leaned into it.
Right.
It was incredible.
There are a couple of things I'm hearing you say. One is that you immediately put together a communication structure that gave people daily, it sounded like, and I'm sure many times, multiple times a day, an avenue for here's what we know. So keeping them communicated. And then I'm hearing you say that you were visible.
Yes.
You were in the environment, you were learning on the ground, checking out what was happening in and around the hospital system, so that you knew real time
Yes.
what was going on. And then it sounded like that you were just, you said a couple times about, I have 2 boys.
Mhm.
I think there's this part of being human that comes into being an empathetic leader where you're
Yes.
like, I understand, I'm fear. Their fear is all about
Yes.
us. And then you activated a priority, and that was safety.
Yes.
So you helped to create that clear priority.
Yes.
I'm with you. I understand, building that kind of empathy structure,
Absolutely.
and then setting that priority of safety. And then right after that, innovation, right? Like
Exactly.
let's find
Right.
what we've done,
Exactly.
right? And opening the door for people to come to you with solutions. That sounded exciting. So talk to me a little bit more about how you see the lessons from that. There are 2 things that come to mind, especially because of your military experience. It seems like that had to be like being in a war zone. And do you think that as a leader, your training helped you respond to the pandemic in a different way than you think leaders that maybe in the commercial setting that hadn't had that experience? I mean, were there things that you felt you were trained to do that maybe helped you in the pandemic?
Absolutely. Absolutely. The military is great about training you how to operate in hard spaces, right? Life and death situation. And so all of the training that I had received up to that point really prepared me to handle difficult situation. It didn't necessarily prepare you to handle a healthcare global crisis, a pandemic, but it did help you to be able to analyze the situation, define what the problem set is, and then what are mitigating strategies that we could use. And at that time, I was surrounded by a really great group of executives that really absolutely leaned into the problem solving. We had to figure out, we were the medical center. So we were the central hub to receive COVID patients from as far down as, down in Fort Benning, Georgia, down in Savannah, from that area, from Columbia, South Carolina. So we were the central hub. We had to figure out, how are we going to receive COVID patients? Because again, we were not set up. So we quickly had to determine, okay, we need to ward off, and we did. We made up a COVID ward, right, where nothing but COVID patients went there. That took the ingenuity of our team to say, this is what we're going to do. And they came in and we did it. And I will tell you, Jenny, that the skill, one of the great things about the military is problem solving. It teaches you how to problem solve. Because again, we don't have the opportunity always to have our higher headquarters say, do A, B, C, D. On the ground, you have to assess the situation and you have to analyze, and then you have to come up with some solutions for that. And so that my training did, but then I was surrounded by folks who had the same training. So that really helped to leverage, what we could do in this time of crisis.
So what a couple of things I'm hearing you talk about here is that, as we're really, even though the pandemic thankfully has mitigated, it's really kind of come to a place that we can live with COVID, but disruption continues.
Yes.
Whether it's Chat GPT, or if it's broader AI implications, or if it's an economic bank failures happening, the disruption that leaders are facing today continues. And I think what I'm hearing you say is that by having this component of being an empathetic leader, really understanding your people, and this ability to really embrace the great skills of rapid problem solving. You talked about analyzing the situation, defining the problem, because if you go after the wrong problem, you're going to end up in the wrong place. So analyze the situation, identify the problem, and then it sounded like you had the relationship with your team to invite the creativity.
Absolutely.
Whether it was training, the outpatient nurses to be inpatient, or identifying the drive-through pharmacy.
Yes.
Like, how did you activate that kind of rapid innovation? That's very difficult to do.
It is, but I will tell you, it was easy to do because the team was there. It's not, I didn't have to, we had built that in the 6 months that I had taken over, we had built that relationship.
The foundation,
which is listening, hearing, anticipating, and working together. We had worked together as a team for about 6 solid months. And again, we all had training. Our military training kicked in. But it is a trust of the team, right? Because I will tell you, during times of disruption, you absolutely need to understand the strengths of your people. You need to be able to lean into those strengths, and you have to trust them that they're going to say, hey guys, I need this done, and they're going to go off, get it done, come back. We're going to assess it. Did it work? If it didn't, we make tweaks, then we move on. Right. It is about trust. It is about understanding what the strengths of your people are and relying on those strengths. It is about effective communication, believe it or not. Because what I say, do you hear what I'm asking?
Right. That's
right?
reflective listening,
exactly.
practicing some of those
Absolutely.
basics.
And then getting the team to say, I don't think what you're thinking is the way we should go. What about this? And me having the ability to pause and said, okay, that makes sense. Let's try it. So I was at the place where I was willing to try things that would keep us safe, willing to try things that would keep the lines of communication open, do things that said, we are here for you. 2,400 people were relying on us, and not just in the hospital, but on the installation of Fort Gordon. And so just imagine, we have probably about 10,000 people on the installation. And so we provided care for those people. So what we did impacted not just Eisenhower, the hospital, but the entire entire installation and across the board. Right. So in disruption, you have to pause to listen, right? In disruption, you have to trust. In disruption, you have to be able to take in large amount of information, synthesize it, and then be able to say, okay, this is where we're gonna go. Because even though I had my great team around me, they were leaning and looking at me for, okay, where are we going to go with this? Are we going to try this? Are we not going to do this? And so it's a trust, and the trust that the team trusts you because you have their best interests at heart.
Right. I love the fact that you're calling out listening, connected with trust, and then decisioning, right? Effective decisioning. At some point, the leader has to make the call or help guide the decisioning so that people are clear about where they're going to go. And that clarity also enables trust, right? So it's interesting, I think, in this period post-COVID, as disruptions continue, and I think this whole, people will talk about VUCA, right? The military term of volatile, ambiguous, what is it?
It's volatile, uncertain, ambiguous, and volatile, uncertain, ambiguous, VUCA, complex environment.
Right. So this VUCA environment that the military knows so well, I think this concept of trust, and you've seen all kinds of literature on it. I think of Stephen Covey, right? He talks about the speed of trust.
Yes.
I really see that coming back in today's environment so much that leaders are saying, for us to be able to mobilize in disruption, this anchor of trust. Any advice to leaders about that? Like, really how you lead in this, creating this environment of trust? How do you do that?
Listen. You have to listen. You have to listen. And, I'm really big into psychological safety. And so as I think about it, you have to listen. That's really how you build trust. I have to be able to listen and put myself in your place. I've always thought I was an empathetic leader, but during this 3 years, I really had to pause, right? And take time to listen. Do I really hear what they're saying? Because our people were fearful. They were afraid. And how do you help people face their fears and say, we can do this.
Right.
We can do this, the collective, but it's listening, knowing that, having your team know that you have their back, right? That if I say move out and you do that, that I have your back, I'm going to cover you, and that we can circle back, assess the situation, lessons learned, and we can move on to the next thing. And so you have to listen as a leader, and you have to listen with the heart, not just with the ears, because it's in the heart that you really connect the dots, and you're able to come back and say, I understand, Jenny, I understand where you are. And in taking that into consideration, this is where we're going to go. And this is how we're going to go together as a group.
And I think that really understanding the other person says, I care.
Yes.
Right. And this is important. And so a lot of that is from the literature, hugely important to the foundation of trust.
Yes.
So I really get where you're going. But I know that we're getting close on time. I want to make sure we have time for questions. But today, when I thought about the great pleasure we have of hearing your story, I thought about empathy. I thought about resiliency
Mhm.
and disruption. We've talked about disruption, but we haven't talked about resilience, because I think when I reflect of what it must have been like to go through that experience, did it build resiliency in the team? I mean, so many corporations today are saying we must be more resilient. Did you experience that with your leadership team? And what reflections do you have around becoming a resilient organization?
Yes.
Yes,
I
is the
think
answer. Yes, is the
it
answer.
difficult. Yes, absolutely. It built resiliency in us. But one of the beauty about the military is that we're always focusing on resiliency because the type of work we're in, it's really life or death, right? And so we want to build resilient people. How do you do that? It still comes back to listening. They care about me. That means if I fall, they will pick me up. That means if I'm going through a difficult time, they will hear me out and they will assist me. But then you want to build that sense of resiliency that no matter what we're going through, I can do it.
Right.
And so for the team, we demonstrated that, our people demonstrated that. And I'll tell you, if ever we should go through another crisis, I don't want that ever. But I think we have a more resilient healthcare community. We have a more resilient hospital environment because we have been through it, and the team now understands it. Our physicians, our nurses, our administrators, our custodial staff, everyone had such a key part in us getting through this, that the sense of we can handle anything else that comes. It is innate, it's built in from just this experience. And our team has done such a phenomenal job. And I think for leaders today, to say, we need to be more resilient, you have to be able to push the envelope a little bit. How do you build resilience team? You got to take them through something and come out on the other side and say, I get it now.
It's interesting that you say that, because I wholeheartedly agree. I think you have to have a team, right? I think having that team structure gives you the strength that you can come together, bring on the strength of each other, creates the strength of the team. And then challenging them to do something that they may not have done before takes a bit of courage.
Yes.
It takes that creativity that you're talking, that problem solving aptitude. They have to listen to each other and perform. So great thoughts today on the aspects of empathy, disruption, and resiliency. Let's see if we have any questions coming in from our live participant guests today. If you do have a question, please go ahead and post that in the chat. I'd love to have a chance to share that with Carlene, and we'll hear from our guest. Anything else that you think would be important as the questions are coming in around leadership today, that you think that is a reflection that if you had a chance to talk to a group of leaders who are struggling today, there's so many things hitting them, whether it's on the personal front or the business front, how would you encourage them?
What a great question, because I think even as I sit in the space in Shaw, we are there, and it's not to be afraid. Do not be afraid.
Right.
We have to take chances. We need to outline for our team where we want to go. And we need to get input from the team of how best they think we can get there. Common goal. What is our direction? Where are we trying to go? What are we trying to accomplish? And be able to synthesize that information and then provide guidelines to that. And don't be afraid of the disruption. Sometimes you have to break it to make it better.
Right.
And I think for leaders today, do not be afraid. You cannot operate in fear. And we need to empower our people. People across organizations have fantastic ideas. I think you should cultivate creativity and cultivate innovation within your team and make them feel safe, that it's okay, that as we're moving in this path, this journey, that it's okay that, we'll have some hiccups, but guess what? I have your back. I understand that we're here. And we really need to have a place, such as a place where people feel that they belong. So you need a sense of belonging. Do not be afraid. Encourage innovation and creativity, and absolutely build a safe space where your people can feel that no matter what they're doing, that you understand and you have their back, and it drives the path we're going to. But clarity and vision, absolutely.
Well, I love all of those aspects. And I know that Mark Erickson, who manages our podcast series so wonderfully, I know that will be a key part of the lessons that come out. Those attributes that just had I think do not be afraid. And this clarity of vision.
Yes.
Where are we going? That people are clear about in the disruption to make those creative innovation adjustments, but align to that common vision is so important. We have a question coming in from our audience. Knowing what you know now, what would you do differently during the COVID time in the hospital? Is there anything you, reflecting back, would do differently?
Yes, I think I would do more listening sessions. So you're only one person or you're a team of 7. You can only reach so many spaces. But I think I would have set up an area for more open dialogue, right? Hearing more ideas. And hindsight is 2020. Bring in probably more people to the proverbial table because we weren't together. We're virtual, but getting input from across the board. I think I would do that better. I think we did it well, but we suffered a little bit in some areas that I think we should not have had we allowed more people. Again, we were moving fast. We were trying to get as many voices as we could. And I think just probably being a bit more open, right? Sometimes as a leader, it's hard for you to open yourself. I did share my story about my sons with the team that was there, and they knew I had 2 sons and how am I taking care of them and taking care of this organization. And so I shared, but I think I could have been a bit more open with them to say, hey, we're really deeply embedded in this journey together. Yes.
Right. Amazing. Okay. So great advice coming in. Have more communication. I think, that's one of the key phrases that you learn early in leadership: communicate, and then communicate again. Right. So we know that that's really important. And in fact, I think some of the skills that we've learned using some of the virtual technology has actually helped leaders to have additional mediums that they can quickly get groups together. It reminds me of one of the lessons that came out of the book, Team of Teams, which was written by a military leader around the war in Afghanistan, who was saying war had changed. And every morning they would have a 1-hour conference call and say, what do we know now?
Yes.
And he said it got to be where there were over 1,000 people that would join in on this call to say, what do we know now? And it feels like that ability to rapidly communicate, hear from others becomes really important.
It is. Absolutely.
Well, I think that we are about time today. So I want to thank our audience for their questions and thank you for being here. We always end our sessions today with leaders in the arena to ask you, is there one bit of advice, I know we've talked about this generally, that you would share with leaders in the arena today?
Don't be afraid.
Don't be afraid. There you have it. Colonel Carlene Blanding.
Thank you.
Thank you so much for sharing your story and insights. And I know that leaders around the world, women leaders and leaders of color, are all thankful for your leadership and all that you've taught us. So
thank you so much.
Thanks
Jenny.
for being with us.
Thank you.
See you soon.